From the Cronkite studios in downtown Phoenix, this is Cronkite News.
Good evening, and thank you for joining us for this special edition of Cronkite News. Tonight, we're taking a look at the top health stories, including the impact opioids is having on our community, to birth control for mosquitoes.
A movement created by one woman in Rhode Island is now a nationwide effort. It's called Don't Punish Pain. Cronkite News reporter Jennifer Alvarez went to the Arizona State Capitol this morning to find out why people are rallying.
Don't Punish Pain is a nationwide effort that supports opioids for pain treatment and demands that chronically ill patients or people with severe pain aren't left out. Some people this morning saying they even felt discriminated against for not being granted the same access to opioids that they used to have. One story after another, after another.
If I could give them one minute or even 1 hour of the pain that I lived through, I think that they could maybe understand a little bit more.
Each one a story about physical pain and a plea for justice in the fight for opioid prescriptions. The Centers for Disease Control and Prevention say opioid pain medications have serious risks. And according to the Arizona Department of Health Services, from June 2017 to now, there have been over 16,000 suspected overdoses from opioids in our state. In 2016, the CDC created guidelines for opioid prescriptions, and last May, Governor Doug Ducey pushed through legislation to more regulate prescriptions. And the people here claim that these guidelines have negatively impacted their access to the treatment that they need.
If I didn't feel like my quality of life and that of my friends and the man that I love and live with were in literal danger, I wouldn't be here.
They say even doctors have been affected.
The doctors are scared. I really, truly believe that they're scared.
And they want action.
I want the Arizona state law to take away the arbitrary delineation, demanding that chronic pain patients with established records and no missed pill counts or anything choose between medical marijuana or narcotics.
Protests were held at major cities across the U.S., and ultimately, these people just hope that someone will listen and make a change. Live in the broadcast center, Jennifer Alvarez, Cronkite News.
The issue of addiction took center stage today at the state capitol.
Ashley Carter shows us how one advocacy group is trying to legalize a syringe exchange program again this year.
People from all over at the state capitol for Addiction and Recovery Advocacy Day, where they are urging their state legislators to vote yes on House Bill 2148, which legalizes syringe exchange programs.
Sarah Saucedo took this picture with her mother just 3 months before she died of a drug-related overdose in 2017.
My mom struggled with addiction for a lot of her life and most of my life.
Saucedo says syringe exchange programs make a difference.
The syringe services programs are basically the only way to engage with people who are actively using illicit substances, to then connect them with resources, to give them naloxone, overdose prevention education, HIV and hepatitis C testing. We're able to collect used syringes that could potentially be contaminated with infections.
The bill passed the House last year, but died in the Senate.
The biggest opposition that we've heard is that giving people syringes is enabling injection drug use.
People are going to use drugs no matter what, whether they have a clean needle or not. By providing a clean needle, it's to prevent the needle sticks to law enforcement, we prevent the communicable diseases that, cost $500,000 to cure. So it does a lot of things.
The bill has not yet been assigned to a committee, which is the first step in the process. In Phoenix, Ashley Carter, Cronkite News.
The Arizona Attorney General's office continues to help fight opioid addiction. Today, the AG's office trained faith leaders and clergy from across the state on how to administer Narcan. That's a medication that reverses the effect of opioid overdoses. Claire Kelly is joining us live now with more on the effort to save lives through faith communities.
Dozens of people from churches and groups across the valley came together today, not just to pray, but to learn how to help prevent opioid addiction.
My daughter was in inpatient treatment for an entire year. It took her entire college fund. That dead kids don't go to college.
Reverend Tina Marie Reese is a United Methodist minister, but she also helps out the Arizona Attorney General's office by speaking out about her family's struggle with opioid addiction. And she says the responsibility for parents starts before there is a problem. She tells people to lock up their prescription pain medications and to get off the drugs as soon as possible.
Our goal is to give people the proper training to be able to pinpoint and see when someone is having this type of issue. Then, should there be an overdose, understand how to administer the actual drug called Narcan that will reverse the symptoms.
Those who attended learned how to administer Narcan and left with a kit of the drug.
If you believe you're in a neighborhood where you are seeing a lot of people actively using, if you're living in an apartment building where you know there are people actively using, if you want to go down to CVS and buy some Narcan, stop at Walgreens, pick it up. It is over the counter now. You do not need a prescription. If you have a family member you know is messing around like this, yes, get Narcan, 100%. Be ready to intervene.
More than 35,000 doses of Narcan have been dispensed in Arizona, according to the Arizona Department of Health Services. In the broadcast center, Claire Kelly with Cronkite News.
Facts over flavor. That's the message the Arizona Department of Health Services wants to get out to teens. As Ashley Carter reports, the social media campaign hopes to educate youth about the harmful effects of vaping.
The vape industry has grown popular in Arizona within the last 2 years. According to the CDC, 51% of Arizona high schoolers have tried a vaping product, according to data from 2017.
About 1 out of 5 or more even use it on a daily basis.
According to Wayne Tormala with the Arizona Department of Health Services, chemicals like nicotine that are found in some vape products can cause great harm to the brain. But he still believes the youth buy the products because the marketing is geared towards them.
They have flavors called Tutti Frutti and their colors and their special gadgets, and it looks cool. So I think the fact that teens are trying this is probably not different than over the years when teens try new things.
But vape shop owners like Matt McGow say the industry is very careful about selling and promoting to youth. He believes they are just a group of people who started to help people smoking cigarettes kick the habit.
We, as a vape industry, have policed ourselves before anybody even, before the government ever brought up cartoon labeling. It was, we were already policing it. We were bringing it to the attention of other vape owners. Well, hey, that could be construed as, marketing to children. That's the last thing we need.
While teens may not feel any side effects now, doctors are guessing that they may feel the harmfulness in years to come.
We don't know long-term what vaping is going to cause. We believe that it's going to cause probably lung cancers, probably oral cancers, probably nasal cancers.
The department says the vape issue is their #1 priority with youth in Arizona. In Phoenix, Ashley Carter, Cronkite News.
The Facts Over Flavor site contains a fact sheet and videos intended to turn youth away from vaporized products.
Arizona is the epicenter for the West Nile virus. Reporter Alexis Pulick explains what researchers believe is behind this phenomenon.
Researchers found that mosquitoes can now live year-round in the Southwest, and that has spawned a virus so stealthy that it can lead to brain damage and even death. A special kind of mosquito thrives in the Arizona desert. A team of scientists discovered these mosquitoes have helped the West Nile virus take root in the Southwest, with life-altering consequences.
I had my what I consider my dream career, and because of the West Nile, I lost it.
Back in 2014, Dennis Morales used to be a pilot for the Department of Homeland Security. He woke up one morning with flu symptoms, but it turned out he had something much more serious.
1% of the people would actually get meningitis and encephalitis. I was on that 1%.
Tejan in Northern Arizona University, in a 2018 study, found that Arizona is a great environment for mosquitoes carrying the virus.
However, one component is probably the really nice weather in Maricopa County. So there's one particular mosquito species, Culex fasciatus, that lives in Maricopa County without hibernating year-round. So because this mosquito can thrive no matter what the season, that means that the vector for West Nile virus is always available.
Inspectors set mosquito traps across Maricopa County to track the virus. The Arizona Department of Health Services confirmed 11 cases in Maricopa County last year.
They are responsible for setting the traps, collecting the mosquitoes. They bring them back into the office. Then the lab takes those mosquitoes, we process them, test them for the viruses.
Finding a mosquito with the West Nile virus is like searching for a mosquito in a huge stack of traps. Maricopa County Vector Control sets more than 40,000 traps per year, like this one. Last year, in 2018, more than 100 mosquitoes tested positive for the West Nile virus. Mosquitoes found with the virus are sent to NAU to determine where the insects are from and where they're headed.
Some strains that were in Coachella, were near Coachella, the Salton Sea in Riverside County, California, and also strains that were found in Yuma County, Arizona, originated in Maricopa County. So it is acting as a source location.
Scientists at the University of Arizona have developed a lead on birth control for mosquitoes.
The discovery could eventually slow the spread of Zika and other dangerous illnesses. Cronkite News reporter Kyle Dowd talks to researchers about new ways to manage the world's most dangerous animal.
Mosquitoes have bites that itch and can be deadly. Arizona researchers say mosquitoes can carry diseases like Zika, malaria, and West Nile.
When we say what's the most dangerous animal in the world, and we say, okay, it might be the lion or the hippo, but it's actually a mosquito kills more people than any of those.
According to the World Health Organization, the deadliest of these diseases, malaria, killed 435,000 people in 2017. The Centers for Disease Control and Prevention estimates the global cost of malaria is at least $12 billion every year. But a team of researchers at the University of Arizona have discovered the protein that mosquitoes use to make eggs, and they know it will take a new kind of insecticide to stop it.
It's basically birth control because even though a mosquito doesn't die, she won't be able to lay viable eggs for the rest of her life. So that's really surprising and it's pretty exciting.
Miesfeld says it's important to slow the increase in mosquito populations when viruses are most likely to spread.
So if the mosquito population is reduced at a critical time, there's not enough mosquitoes to transmit the virus back and forth. So that's been modeled, it works great. The problem is they get resistant to all the insecticides. So we're trying to do next generation insecticides, kind of like antibiotics.
ASU's Hyben says the global aim is to eradicate malaria by 2040. That may be a long shot, but mosquito birth control and other research is key to reaching that target and eliminating other diseases.
We've seen with Zika that, mosquito-transmitted diseases can come very close to our homes as well. And I think it's important that people know that mosquito control is an important thing to do, and new diseases can emerge all the time and they can affect us as well.
In Tucson, Kyle Dowd, Cronkite News.
Miesfeld and his team took 10 years to find the target protein. They're now looking for a biosafe insecticide that can be sprayed on mosquitoes' nets and stop mosquitoes from taking flight.
An exhibition at the Odyssey in Scottsdale displaying dead bodies is facing some heat from a religious group that claims the cadavers used are obtained illegally. And as Ashley Carter reports, the group is working to get the exhibition shut down.
The Bodies Revealed exhibit came to the Odyssey Aquarium in Scottsdale last May. According to the website, more than 200 cadavers in the exhibit have been preserved to help visitors understand the human body. Groups worldwide have protested displays like these.
See yourself like never before.
The Arizona Fallen Dafa Association is a religious organization. Members say the bodies used are those of unclaimed prisoners who died while incarcerated for their religious beliefs.
In prison, these practitioners were persecuted, and after they were persecuted to death, their bodies were sold out and were taken around the world to make profit.
People are truly ignorant of where the bodies come from and the persecution. I've been talking about the persecution for 18 years now, and I've only found 6 people that already knew about it in the United States.
The Odyssey Aquarium declined interview request, but sent a statement from Premier Exhibitions that read, in part, quote, "Each body and organ specimen in the exhibition came from individuals who died of natural causes and who consented to donate their bodies for medical and scientific purposes, including public education." The donations were made to several universities in China, primarily Nanjing Medical University, but there are still some questions.
There was an independent study undertaken by 3 human rights experts who determined that they were not confident that there were careful records demonstrating that the bodies came from donors who willingly consented to have their remains used, plastinated and used and displayed in these ways. So I'd be pretty suspicious of this particular exhibit.
The exhibit is scheduled to be open until May. In the Broadcast Center, Ashley Carter, Cronkite News.
Video chatting with your doctor may seem like a thing of the future, but it's already happening nationwide.
And advocates of an Arizona bill want to expand virtual healthcare. Cronkite News reporter Jennifer Alvarez explains the role telemedicine could have in our lives.
Imagine a robot treating you when you're sick. Well, a doctor within a robot. It's already happening in Arizona. Dr. Bart DeMarshall uses telemedicine with patients. It's a way to virtually treat or diagnose patients, whether they're at home, the hospital, or a clinic. He says it bridges a healthcare gap.
Many rural communities are medically underserviced. They may have some specialties, but not all. And rather than patients being transferred, sometimes hundreds of miles away by air or ground, essentially the specialist can be brought into that community.
Senator Heather Carter, a sponsor of a telemedicine bill, agrees.
If you live in an area in Arizona that you do not have access to a specialist, like a urologist, for example, now you can use telemedicine to connect to that individual no matter where the practitioner may be located.
SB 1089 is about expanding insurance coverage of telemedicine. Right now, telemedicine coverage is limited to specialties like cardiology and dermatology. The bill would allow coverage of any medical condition or illness, just like in-person contact between doctor and patient.
We in healthcare are obligated to provide the best care to our patients, and the best care today includes incorporation of digital health technologies, and it's the future of healthcare.
In Phoenix, Jennifer Alvarez, Cronkite News.
Bill advocates say virtual healthcare may also be more efficient for routine doctor visits and cut down on missed appointments.
Minimum wage workers in Arizona are getting 50 cents more per hour this year in their paychecks. Reporter Kyle Dowd explains how this increase could affect your wallet.
Local businesses, both small and tall, now pay their minimum wage workers $11 an hour because of Proposition 206. The wage increase is being done in steps and will reach $12 an hour next year.
I feel like some people need the money now, but they're forced to slowly move up. But I mean, I guess some raise is better than none.
The Greater Phoenix Chamber of Commerce represents 2,400 businesses. It recently surveyed its members and found more than half said Prop 206 took a toll on their bottom line.
We have always had the stance that it was going to have a negative impact on businesses, especially small business.
For minimum wage employees, paid sick leave and an extra 50 cents an hour can go a long way. But the businesses that pay those wages must find ways to compensate. Of the businesses I spoke with, 70% said they have or plan to raise their prices this year. But it's not just wages that have gone up. One restaurant owner I spoke with, who declined an on-camera interview, said distributors have raised their prices as well, hurting his profit margins.
To further put pressure on businesses in this manner by increasing it a dramatic amount, as high as it was included in the proposition, has resulted in higher prices, lost jobs, and hours being cut.
Despite these challenges, Montserrat says the pay increase does more good than bad, considering the number of minimum wage workers affected.
The vast majority of those who are working minimum wage currently have kids that are in their 30s. They don't have a way to move up to a higher job.
In Phoenix, Kyle Dowd, Cronkite News.
In 2020, the minimum wage increase will take hourly wages to $12, a nearly $4 increase from the minimum wage in 2016 when Prop 206 was passed.
Arizona cattle ranchers are using innovative ways to produce good quality beef. Ashley Carter takes us to a cattle ranch to see how they're developing better beef while catering to the cows' well-being.
The beef industry has changed since Chuck Backus bought his ranch 42 years ago.
The quality of the cattle have increased considerably over that time, mostly due to careful breeding, selective breeding it's called. The cattle have gotten more efficient, they've gotten better acclimated to different climates.
Tiffany Salchow of the Arizona Beef Council says research is key to improvement in the industry.
We are a community of people that are always looking at ways to improve what we're doing. So we like to say we're always continuously improving things.
At the Quarter Circle U Ranch near Gold Canyon, ranchers genetically breed cows to exhibit more independent behavior, including giving birth without help.
Out here in the Superstition Mountains, it takes us about an hour and a half just to ride our horse to where the cows are located currently. And so if we are having to provide assistance to those cows during calving season, it does make it a little bit harder for us.
And during their lifespan, the cows here are treated quite well. According to Salchow, the less stress a cow has during their lifetime, the better the product.
We want them to be calm and quiet, which overall helps impact a nutritious value beef. We don't want, when it comes time for harvest, for them to be harvested, we don't want them to be considered a dark cut when there is an abundance of adrenaline built up in the muscles. We want that red meat, we want that meat to be nice and red.
Arizonans continue to put beef on their tables. In 2016, cattle sales were more than $1 billion, according to the council. In Gold Canyon, Ashley Carter, Cronkite News.
Other common practices for ranchers include vaccinating cattle and having nutritionists on hand.
One city has a creative new way to educate people on proper wastewater disposal.
Cronkite News reporter Jennifer Alvarez traveled to Surprise to find out how they're doing just that.
The city of Surprise is teaching residents to be gross, but it's not what you think. It's a new campaign that actually stands for Be Guardians regarding our sewer system, and it can help you save money.
I never really thought what happened when I flushed the toilet. Just because it's flushable does not mean it's dissolvable.
Andrew Johnson is a lead wastewater operator at the South Water Reclamation Facility in Surprise, and he sees things that don't belong there every day.
I found $5. I was very happy about that.
And on their Instagram, I found 20. And also a rubber ducky.
Kids love to flush toys down the toilet.
What else do they see?
We see everything, feminine products, we see rags, flushable wipes.
You'd be surprised at how much plastic gets put in our sewer systems.
And all those things cause major issues at the facility.
It can actually get caught up on equipment, and once it gets caught on the equipment, it sort of starts to get tangled with other items.
This creates what are called rag balls, which have to be manually removed before they cause damage. But not all equipment is so accessible. Some is underwater, which makes it harder to clean more frequently.
Ultimately, what you should be flushing down your toilet is number 1, number 2, and toilet paper. And that's it. Those 3 items are really what the plant was designed to treat. Anything else is going to cause issues that are very expensive.
According to the city, about $300,000 are spent each year on average due to improper flushing or disposing habits. And that money for maintenance is coming from taxpayers.
The rates that the residents are paying to go into their sewer bill are what's really funding our ability to treat and, mechanically remove things that shouldn't be there. So ultimately, that is where the money is coming from.
But not to worry, it's not all down the drain from here. We can actually help by changing some simple behaviors.
It's extremely easy to take that hot grease and pour it down your drain and turn on that hot water. It takes time and effort to put it into a coffee mug and let it harden and then scrape it into the garbage can.
But even though it takes more effort,
it is 100% worth it. In the long run, it'll save us money, which saves the public money.
The campaign kicked off early January, and ultimately, the city hopes people will make better decisions about how they flush and what they choose to put down the toilet and drain versus into the garbage. Live from the newsroom, Jennifer Alvarez, Cronkite News.
Kava has been used for thousands of years as a sedative, but the supplement is coming under scrutiny by health professionals over safety concerns. Kyle Dowd talks to an Arizona business owner and a medical doctor who agree there needs to be federal standards.
Kava is often marketed as nature's Xanax, calming anxiety and stress.
The feeling of being dazed but not confused.
Chase Brendel will open what he says is Arizona's first Kava bar in Phoenix next month, hoping to catch a business wave of more than 100 Kava bars around the United States.
It just takes the edge off. You know, it makes it a little bit more fun, makes you feel a little bit better while you're hanging out, makes you very talkative. But again, you're not losing control of yourself, of your faculties like you would if you were drinking alcohol.
Kava bars are a part of the emerging relaxation drink industry. By 2023, the industry is expected to be worth nearly $500 million. But Arizona toxicologist Dr. Michelle Ruha says Kava can, in rare cases, put users at risk.
It's definitely been associated with very severe liver disease, including liver failure and people having to have liver transplants as a result of their Kava use.
In 2002, the FDA issued a consumer advisory about possible medical problems. Dr. Ruha says government standards should be rigorously applied to Kava and other herbal supplements. She points to several studies warning consumers about the potential side effects.
People use them as medications, so they really should be treated like medications.
Brendel agrees and says perhaps the federal government should step in to assure the quality and purity of Kava.
My goal would be in the long term to see it be regulated, because what happens with a lot of Kava bars is, right, they want to get into it in a cost-effective situation. They're buying it from the cheapest distributor they can find, and there's really nobody that says, hey, this stuff is good. This stuff is clean. It's been processed in the right facility.
Brendel says he will keep on top of the quality of the Kava he sells. In Phoenix, Kyle Dowd, Cronkite News.
That's it for this special edition of Cronkite News. Thank you for joining us. For top Arizona stories anytime, go to cronkitenews.azpbs.org.